You're listening to On the Mic with Mike every day. He's a businessman with his own talk show. On the Mic with Mike is the best business radio program in the game. Ladies and gentlemen, welcome back to On the Mic with Mike, the premier business radio program around. I'm your host, Mike King. I appreciate you being here with me. We're coming to you today from ESPN Studios. It is part of the Mike King Biz Radio Network, which is ESPN Richmond 106.1 at 5 to 7. The Choice every day from 2 to 3, as well as International Business Growth Radio. You know what time it is. I got the folks back in the building. We have Poplar Springs Hospital. Welcome back to the program, folks.
Thank you very much.
Hello. All righty, Lamar, we're going to start off with you. We always start off. Well, one thing before we get started, we'd like to thank you guys for sponsoring the SOFA, the Southern Virginia Chamber of Commerce, for coming back to radio. It's always great when we have the Chamber of Commerce. So John Brandt and the folks out there, thank you for that. So Lamar, it's time. Let's get the elevator pitch.
Absolutely. So first of all, my name is Lamar Taliaferro. I am Director of Business Development for Poplar Springs Hospital, located in Petersburg, Virginia. If you or a loved one is suffering from any mental health issues and you want a free assessment, you can feel free to give us a call at 866-546-2229. We have inpatient services, outpatient services, and we even offer services for our military.
And you have the evening services.
Yes, sir.
There you go.
Yep, we have the evening service for IOP at the Grove. Yep.
IOP.
Intensive outpatient program.
Now, you know, I'm going to get started. I'm trying. I'm holding it together because you know I'm getting ready to get started. Shout out to Artie. So people are out there in need. So Lamar, you're not here by yourself. Who'd you bring with you?
Absolutely. So I brought our Chief Nursing Officer, this is Mr. Kent Alford. Hello.
Kent, welcome back.
Thank you. All right. And then also I brought our Director of Clinical Services, Amy
Pathman.
Amy, welcome. Okay, there. He had a moment.
Right.
It's that is the reason why I don't introduce people, because they get halfway through their name and be like, "Excuse me, what's your name again?" And then we got issues. Kent, you're a veteran of the program. Let's talk about. We're going to start on the clinical side because you're here to talk about something serious.
Yeah.
Well, what is it? What is it? Compassion fatigue. Is that what we're here to?
Yes.
That's something real.
That's the new buzzword in healthcare. Some people know it as burnout.
That's a technical old school term.
Yes. Yes. But today we're here to talk about compassion fatigue and just our healthcare workers. You know, we've been under the whole thumb of COVID-19 for what, Amy, about what,
going into our third year.
3 years. And it has really it's put a heavy weight on all of us that work in healthcare, whether we are EMT, firefighters, or whether we are nurses, doctors, and techs and clinicians. All of us are feeling the heavy of this burnout. So I'm here to talk about that today.
Alrighty, so Amy, what part do you play in the process? So we've met some other folks who've come and talked about different aspects of clinical care. What part do you play?
I'm the Director of Clinical Services on the acute side of our facility.
So when people are in acute, meaning when people are in bad, no, I don't want to call it that, but when people are in, yes, that's exact. You know, that's the exact word that I was looking for. But people are in crisis. That's the part that you play.
Yeah, so we see them in crisis, which is really the worst of their bottom out. And then we, on our side, are here to stabilize them and ensure that they are safe to go back into the community with the right community referrals, safe family support systems to go home to.
I always ask people, how are people doing now as opposed to 18 months ago? You both, you know that that's a technical term, and they both go.
Yeah, I don't know. I don't think it's any different really, because you have a lot of things come into play, especially in the healthcare. You have staff shortages. You still have COVID going on.
Right. You know, I have seen a rebound effect where it kind of slowed off a little bit because of COVID. People couldn't come to the hospital. But boy, when they came back, drug addiction is at an all-time high. Suicidality, depression, isolation, grief, anxiety. I mean, we're seeing it. We are bombarded with the emergence of mental illness and our ability to meet the community need.
sometimes people are thinking that we haven't seen the worst of, because we haven't seen the worst of what's happened to us as a society because of COVID. What do you guys think?
I can agree with that, especially I think in the adolescent population, when they have been isolated at home, some of them still choosing in-home rather than going back. And you have the whole aspect of, like I said, the isolation, the social skills, social media also has been played a big part.
Yeah, we're seeing an emergence of families that are really separated. You thought being forced together would have caused more closeness,
No, man.
but it actually brought the pathology out more. We're finding that sometimes parents are tired and they bring their kids to the hospital for temporary relief and sometimes even permanent relief. So we get caught into.
So wait a second,
that.
what the heck is, like, I'm just bringing them here and saying, yo, y'all got this?
Kent and I got it.
Yes.
Yeah, I think the permanent relief of, I mean, the children and adolescent population, we have seen the increase of just the behaviors. So they are stabilized in acute facility. They go home for a little bit, could be days, could be one day, could be a week or two. Then they're readmitted due to the same behaviors. Not having that support in the community, still isolation and suffering from the same symptoms.
So Ken, let's talk about the compassionate, where people are really just tired and burned out. As a caregiver, what are some of the signs that I'm seeing that I'm running into some problems?
Well, first, when we talk about burnout, the definition is a state of fatigue or frustration brought about devotion to a cause that failed to bring an expected reward. And it's emotional exhaustion, depersonalization, and then reduced personal accomplishment. So you think about all the things that we want to do as nurses and clinicians, right? That we want to save the world. We want to have the best outcomes. We want people to be reunited. We want to just tackle everything. Well, the reality is that because of other social structures, we can't impact all those things. We may only can do one of those very things that we set out to do. And then that causes caregivers to actually experience being depersonalized or not feeling that their work is valued. So you see a sluggishness, a kind of dreading to get up, to go to work. And then those feelings actually exacerbate as time goes on.
Okay, Amy, we're going to talk to you, but this is the technical side. One of the great parts about having your own show is I can ask all the questions and you guys have to be the experts. Who saves the caregiver? There we go with that one again. You guys see the worst. Yeah, you guys see, I'm not going to call it the worst of the worst, but you see bad. How do you go with that not sticking to you when you leave Poplar Springs? You don't take that with you.
I think that's the biggest question of it all, really, because that's the thing that we were saying before we even aired, but you are dealing with this and the people in their crisis on a daily basis at work, and then you go home, you have to be the mother, the wife, the sister, the cousin, uncle, aunt, whomever it is, and it keeps on going. So you're getting physically and mentally, emotionally drained. Luckily, I mean, our agency and our corporate UHS has the employment assistance program. EAP. Yes, we have had several reach out to that. I know that several, we talk about self-care all the time. My own clinician gave me my weekend plan of self-care this weekend to make sure we're taking care of ourselves.
You know what, if I can add on to that, if you have EAP, if anybody has it in their benefit, you must use it. It's called Employee Assistance Program. And a lot of people have it and never touch on it. And
I think people are kind of scared. I think because some of the times people think that people kind of may look at, now I'm not an expert, so don't be getting on me. But people kind of look at that as sort of like HR, like HR is there, but is HR really there for me? I think sometimes people are scared to contact. Well, that was prior. I don't know how it is now because people are more open to getting help than they were 2 years ago. I know for you guys, maybe it doesn't seem like that, but for the regular Joe who's after like me, it doesn't seem, it still carries a stigma, but sometimes people are so desperate now that the wheels and came off and I need to get some help, or well, my child needs some help. And before I could mask it.
No, I was going to say that when you use the word mask, a lot of people and employees do mask it. They mask it with substance use, for example, and that's another increase in substance use. It's just not those that are TDO'd in our patients, but it also, it's like you said, the regular Joes are returning or.
Right.
to that.
And also back to the EAP benefit, is that we have outpatient services. So you can still utilize that benefit, go to work, you go to our nighttime IOP program
It's at the Grove, correct?
at the Grove.
So there you go.
Seems
There you
like
go.
it.
Yeah, good, good job.
I'm getting ready to start throwing out some acronyms, and Misty's not here, but I'm gonna make her proud.
Yes, absolutely. And, when I talk about burnout, one of the things that we're doing for our employees at Poplar Springs is that we just created a relaxation room. It has a massage chair. It has food for healing. Has like
The
colors, the
waterfall.
waterfalls, everything right there, because you may not can make it home and then have to manage that. It is a beautiful room created by our corporate sponsors to make sure that we take care of our employees in the moment.
Because 3 or 4 years ago, that would have been like gobbledygook. Come on, man. Really? You're telling your employees to man up, you're only here 8 hours and do the best you can, and that's it. We look at things a lot different now. Because we have to. Here's another one. You guys just had a job fair recently, right? Okay. I'm not an expert, but we're all having problems finding workers. How do we not work the workers that we have till they fall out or either walk out? How do you do that right there during this time?
That's it. So good question. As a CNO, Chief Nursing Officer, unfortunately, I am in the middle of a national shortage of nurses and mental health technicians. We just don't have them. So we have to be really, really supportive of the people we have, making sure that they take their days off. So this thing called PTO means you should go. And you should go when it's time, when you feel like you need to use it. You shouldn't be accumulating a ton of PTO because you really got to take care of that mental health, taking care of that person in the moment. If I see one of my employees stressed out, I'll pull them to the side and say, what do I need to do? Take a break outside, take a walk around the block. I mean, whatever it takes, I have to be that person so that my workforce that I have now won't continue to burn out.
Because you can see it coming.
It's like they do it on the airplanes, right? That you always put on your mask first, so you're able to take care of somebody else. And
It
you
was
have to
forever before I understood that.
Me too.
I mean,
I didn't know that now.
Teach you something every week.
Exactly. See, that's why you come to On the Mic with Mike. I didn't get that until, I don't know, maybe 5 years ago. Then the person says, because if you don't put your mask on, you ain't gonna be able to help.
anyone else.
And and it's just tough because the natural inclination is, let me just go ahead and give it to you, put it on now. I'm out there and I'm not taking care of me. That's what you guys are talking about, the self-care. Alrighty, so when we're looking out at the idea of the burnout, what are some of the signs that you guys would see that we need to be on the lookout for?
So sometimes in healthcare, you have what we call trauma desensitization.
Hey,
So
you'll be coming up. You
you
got to be back at the lab with a pen and pad. Okay, what's that mean?
So basically, every day we hear stories of suicidal attempts and homicidal attempts, but the person that's experiencing burnout, they can just hear it and it's not a reaction to it. It could be just, okay, yeah, let's just go on. What's the meds? What's the plan? And not have that empathy and caring. So that desensitized self becomes obvious and prominent. And then, of course, that goes down a slippery slope with everything else decreasing. What else you want to say to that?
No, I like how you did say that, because like we mentioned, kind of robotic in a sense, and kind of just keep on going with the day and not having any of that empathy throughout the workday. So if we're not experiencing that, we're going to be also seeing, excessive blaming other people for things, complaints, isolation from others at work.
At the end, it really gets bad. That's what you mean, blaming. You start to become reactive,
right?
Negative thoughts and feelings, really hating the job. I hate to say that, use that word hate, because that's a strong word.
That's a big one.
But people really have a strong dislike for wanting to do the work. And so really getting to that point, you should be doing some things well before that, so that the person doesn't get to a point where coming into work is dreadful.
Right.
On the mic with Mike, you're the good friends from Poplar Springs Hospital. They're with us every week with their sponsors of the program. They're doing some really outstanding things out there. Right now, we're in a tough time. And Kent, we always ask, how are people doing out there right now? And we go with the mature, the older set. How are older people doing? I always ask you guys, I ask Misty when she comes, how are the young people, how are the older people holding up? Like, what's happening with us?
You know, when we look at our community trends, population trends, drug abuse is really on the rise. And it's not just the young people, you know, experimenting. It's people, older people, as you mentioned, that are settled, that can't understand, they've never perhaps taken care of their mental health, but alcohol will take care of it. We see opioids on the use. We see all kinds of drug use in this particular area. So this is one of the ways too, Lamar, we're looking at dealing with our detox services and how we are a community support, because we're seeing abundance of that post-COVID.
And we just hired a CSAC that's going to be running our
PSYOP, the PSYOP program.
Because we're running our outpatient program.
What is PSYOP?
Substance abuse intensive outpatient program.
Yes.
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 I was going to ask that question. I asked
Yeah.
SAIOP.
Okay, and so how does that differ from the traditional program?
So it's going to be more focused on substance abuse. So it's still like the PHP, partial hospitalization. They'll still be involved in groups throughout the day, but it's going to be more focused on those co-occurring disorders with substance abuse as the primary diagnosis.
But now, I'm not sure if you guys are the ones to ask. Back in the day, and I hate to be like the old person, but it would be like marijuana is a slippery slope. If you start that, next thing you were going to go to all the other things.
Gateway.
Well, I'm telling you what, that gateway done swung open. That gate, especially if you're downtown Richmond, or it seems like the smell of marijuana, I just want to use the technical term, is everywhere. And where that it's not there, then it's everyone going and getting edibles or whatever those other things are. From the clinical side, what do clinicians think about? And if you guys can't touch on that because of the hospital, hey, I understand, but I got to ask it.
So, you know, let me take it first.
Sure.
Okay.
Go ahead. Yeah. Go ahead.
No, okay. You know, marijuana is still a substance. And like any substance, even though alcohol is legal, and overuse of it can make it clinically detrimental. So even if it's legalized, even if every person down the street is smoking it, it's still, we are still here to support where you are. If that's an addiction, how you manage that, how it doesn't impact your life, because you still have to get up, work, and have children, eat, sleep, and do things. So we still manage it as potentially as an addictive drug. And yes, we are seeing cannabinoid use increase, but we're also seeing addictions related to cannabinoid use. So we have to figure out how to manage that.
Right. And it can still affect, marijuana can still affect your socio-emotional aspects of your life. And like you said, if that's still being affected, then we still have that addiction.
It's an addiction. Right.
Well, the Mike with Mike, ESPN Richmond. This is part of the Mike Kingbiz Radio Network. ESPN Richmond 106.1, 5 to 7. That's where you hear the good folks from Poplar Springs Hospital. They also visited us over on The Choice 105.3, and we're there 2 to 3. Kent wasn't with us that day, was he? No. He missed out on the fun and festivities.
Yeah, that was just a pop-up. I just popped up.
Oh, that's right. Yeah, you guys are just doing a drive-by. We understand. That's what happens. You come up here and you check on us. Poplar Springs is doing some really outstanding things. So if a person has a regular job, they have a job during the day and they need help.
Yes.
It's not that they don't have to. If you're in crisis, you guys are there 24/7. Someone is going to answer the phone because it is a serious subject. So Lamar, let's talk about, you guys have multiple services on the Poplar Springs campus.
Correct.
Let's talk about what you guys have down there.
Sure thing. So basically spread across about 20 acres of land, we have an acute hospital for adolescents and adults. We have an outpatient program called the Grove that does both day and night programs, PHP and IOP. We also have a full-time, a full-service military hospital dedicated for the military, services provided by either retired or active duty military. And then we also have our RTC, which is our residential treatment center for adolescents only, ages 11 to 17.
So that's what's going on down there. So there is help out there to be had. Ken, let's talk about the role of the chief nursing officer. What exactly is that?
It's a lot of things. First of all, I consider myself a part of a team of being able to make sure that we have good outcomes, that we take care of the population that we're entrusted to, and that my nursing team, my nursing staff, as well as my non-nursing staff, have all the tools they need to be successful in treating the mentally ill. And as an executive, my job is to make sure we meet policy, regulation, and high standards for care that we know that will work in behavioral health.
When we still are battling, you guys go above and beyond as far as the COVID issues go. We're still not out of the woods with that. That you guys are shaking your heads like, no. Let's talk about what that means to Poplar Springs.
We still follow the CDC guidelines for infection prevention. All of our patients are tested prior to coming in. We know that there will be a small amount of our population that will be positive. So we look at how we manage them. So we keep them in safe spaces. We still manage when they come to the hospital, but of course, making sure that our staff is educated in infection prevention, hand washing, donning and doffing of gloves, make sure they're aware of the current education, as well as the CDC guidelines. We follow them religiously every day.
Because on the mic with Mike, we're coming down to the facility for you guys. And I get the note that says, before you roll up in here, you better show us that vaccination card.
Yes.
Don't think you're just coming in here all willy-nilly like, yeah, I got it. No.
Yep, all of our visitors.
Yes,
get
show it from
vaccination.
outside through the window. And then when you see you're good, now you can come on in.
We are about to start visiting, by the way. We look at the population, what's the positivity rate in the community. If it's below a certain number, we're able to start that. And our numbers, the good news in this area, Richmond area, is they're dropping off, right, Amy?
Right. So we will be going through visitation.
We'll be starting
that
visitors
back up
coming
with-
back to the hospital.
Let's talk about how important that is, the visitation to somebody in there. They're stressed out
Yes.
because they're away
Yeah.
from their friend. They're in places they probably don't want to be.
Right.
And let's talk about what that really means to them to be able to see friends and family, because possibly the last time I saw Johnny was not under very good circumstances.
Right.
And now it's 2 weeks, 3 weeks, a month later, Johnny's doing a lot better.
Yeah, it's actually going to hopefully boost, the progress for the patients, having that support, seeing somebody face to face again, rather than a telephone or via Zoom. Right now, we do family sessions sometimes via Zoom. And then hopefully too, it gives us the opportunity to observe the family dynamics, communication, things like that as well.
That is the most crucial part of our treatment team, treatment process. We got to involve the families, particularly for adolescents. We can't isolate them, and having visitation, it provides us clinical diagnostics for what to do next, how to manage what we got, and how they'll do when they leave.
One mic with Mike, we have the team from Poplar Springs. Whenever you show up, man, it's always some serious topics. Yeah, exactly. It is. So we're talking about compassion fatigue. It is. That's sir, thank you very much. When we're here, but there's subjects that we need to talk about. And compassion fatigue, the caregivers are tired. We've been doing this for a while. We've given as much as we can. So you're there talking about that. You were here before, we were talking about the suicide, what's going on. And it only pops up when sort of somebody famous. Now, the soccer player,
committed suicide.
and and it was a couple weeks ago, the Miss America, whatever.
Yeah.
There's a lot of times that goes on in between those times that doesn't get that national press. Let's talk about for parents who are out there, people out there. I mean, as a dad, you see moms, they're crying, but when you see dad breaking down about his daughter, and then they're like, okay, we're trying to figure out what's happened. Let's talk about what that means, some signs that people could see, something so that you're not ending up in that position if at all possible.
I think a lot of it is the isolation, right? The withdrawing from your support systems, the masking of substance use, you recognizing that we're turning to substance use to kind of mask the negative feelings that you have.
And I would say having protective factors. And when we talk about suicidality, the biggest way to prevent is protective factors. That's having a dog, having a family member, having a religious support, having somebody there that you can rely on when that day isn't going well. That's the biggest thing that you can do as a preventative measure to prevent, hopefully suicide and depression.
On the mic with Mike. So Lamar, how can people find you guys out there? Again, all right, we got to talk about your community involvement too, that you guys are big with the community. Let's talk about that and how people could find Poplar Springs.
Sure thing. So first of all, you can go to our website, www.poplarsprings.com. where we have a new section where we're announcing all the upcoming news.
Y'all got breaking news?
Yeah, one being this partnership here.
Whoa, that's what I was like. Did I say I love breaking news?
But we also have, we're working with a bunch of local community partners. We just started a partnership with the Chili Peppers baseball team. We work with the Petersburg YMCA. So all that stuff is listed on our website. But if you need us, you can always give us a call, 866-546-2229, poplarsprings.com.
And we're coming down there. We're talking, you didn't roll out the heavy hitters for us. You got the mayor as well as, what is she, the fire chief, the lady?
Yes.
Man, thank you. We're taking our talents to Petersburg, and they done rolled out the red carpet for us. So on the mic with Mike, ESPN Richmond, because what do we do? That's what we are. We are the best business radio program. We're here 5 to 7 a.m. daily. That's what we do. So on the mic with Mike, ESPN Richmond, 5 to 7 a.m. The Choice 105.3, as well as International Business Growth Radio. Mike King, we're here.
Mike King says.
On the mic with Mike, we'd like to thank you for tuning in to our good friends here at Poplar Springs. On the mic with Mike, you can find us here daily. We are the best business radio program around. Shout out to my hometown. This is straight up out of Philly. I can't help it. This is not the typical business program, but we'd like to thank our friends here at Poplar Springs. Lamar, when last time, how can people find you?
You can go to our website, www.poplarsprings.com, or you can call us toll free at 866-546-2229.
That's right. Summertime is coming, folks. Make sure you take care of ourselves out there. Take care of each other out there. I mean, because we're going through some hard times right now. Don't, if you see a person over there kind of hurting, make sure you give them a shout out and take a listen and keep in contact with our good friends down at Poplar Springs. They're doing some amazing work. We're coming down in a couple of weeks, so they're rolling out the red carpet for us. We're also going to be at the home and garden show. That's where we're going to be. We're going to be out there, with John Brandt and all the good folks at the Chamber of Commerce. On the mic with Mike, we got to go. We're out. Take care.